Welcome to the Do No Harm podcast, where we discuss the battle to keep politics out of medicine. With our hosts, Dr. Marilyn Singleton and Do No Harm's founder, Dr. Stanley Goldfarb. Together, we're talking with people to create a better healthcare system for all, one that's based on medicine, not division.
For years, the Academy of Pediatrics, otherwise known as the AAP, the American Academy of Child and Adolescent Psychiatry, and the American Psychiatric Association have placed their institutional credibility behind the concept that the medicalization and affirmation of youth with gender dysphoria is sound medical practice. These organizations had built reputations on quality peer review and had earned the public's trust. But with their certainty on the speculative concepts of youth gender dysmorphia, or so-called gender-affirming care for youth, they lost the trust of members, practitioners, and many in the public. Instead of peer-reviewed research and scholarly discussion around these topics, there's been little, if any, open discussion, let alone debate. Instead, the leadership of these organizations has become influenced by political activists insistent on presenting a single dogma, that gender-affirming care for youth is evidence-based and life-saving. But we know both to be untrue. We're going to discuss this institutional capture with our guest today. Dr. Kris Kaliebe is a board-certified general forensic and child adolescent psychiatrist and professor in the Psychiatry Department at the University of South Florida. He has been outspoken on both gender ideology and the impact of DEI in his field. He recently wrote a great article excoriating the pediatric leadership for its response to so-called gender-affirming care in children. Welcome to the show, Dr. Kaliebe.
Well, thank you for having me.
Yeah, Dr. Kaliebe, it's great to have you with us. Let me ask you, sort of jumping to maybe a little bit further on in what might be a typical discussion of this issue, but as Dr. Singleton mentioned, there's been just a huge outpouring of support for something that many of us feel has been a medical scandal, and that is this idea that children that are confused about their gender ought to be put on this train of activity that ends up producing often some terrible, irreversible changes in them. How do you think this happened? How did so many organizations get captured by this idea that this really is a scientifically valid approach when, in fact, the science, as you've pointed out in your articles, is so poor? How did this happen?
Well, that's a great question. I think, it will take a little looking back to really piece together the puzzle. I think there were a confluence, different trends. I don't want to steal a thunder from an article I would like to write, but I can tell you it's quite interesting that just a couple years ago, within 4 months, there came out 2 different articles, and one was about the perfect storm of how the online world has a social cultural influence on personality development, and people became much more a subsegment of people, especially adolescent girls, became much more preoccupied with their own appearance. And so you had this generation that's growing up with much more feedback and emphasis on their appearance. And of course, this is a subgroup, but in the article that I read by Chuckus Bradley, basically she points to how constant checking and always being picture ready and all this influence on appearance was, of course, very stressful, and especially for girls because they're the ones being measured more and measuring themselves more. And it's led to a number of negative outcomes, which, she was looking at depression and eating disorders and such. And so you have a generation that has grown up online, and I think it's the biggest generation gap probably in human history, because growing up online is so different than growing up only real world, sort of affected. So I believe that's one piece of it. But then there's another kind of perfect storm, and this is, I'm taking from the Alison Clayton article about gender-affirming treatments and the perfect storm for the placebo effect regarding gender-affirming treatments. And so you, at the same time, had this change in a generation of kids growing up online. You had a population, a medical professional groups like WPATH that were influenced by ideology. I mean, you have two different things going at the same time. One is patients with gender dysphoria, which are a diverse group, and certainly are patients that are deserve the best treatment that's available, and people's help and sympathy, and a medical system that responds well to those who have gender dysphoria. But at the same time, there was a whole bunch of ideology that came along within professional groups and activist groups, and sometimes this is counterintuitive, but Nicholas Taleb wrote this, part of one of his books, he had how the most intolerance wins the dictatorship of a small minority was one of the chapters in his book, Skin in the Game. And I think there was a very activist group that felt that they, were going to take some of these ideas that are reflected in what you may say gender ideology and take it into medical organizations and demand treatment that corresponds with the ideology. I think that came into the academy. And so basically the American Academy of Pediatrics, American Psychiatric Association, and Endocrine Society, especially in the small groups. I mean, I'm affiliated with the psychiatric groups, and I was affiliated somewhat with AAP, American Academy of Pediatrics. And, the gender group that's a very small piece of the organization. It was, usually just a sub-component. But once again, when you have a really strongly motivated and insistent minority that's claiming to, make a really strong moral claim, I think that can then push the whole organization. So I gave you a long answer, but I think you both have things that have percolated up in society, and you have things that have happened in the professional organizations where a somewhat intolerant, aggressive minority position became the dominant position.
Got it.
Well, I have a question along those lines. You talk about social media and its effect, and particularly in females. It was making me think about this uptick in gender dysphoria that like it's a peer group thing, like how cutting was, or the girls for a while who all wanted to have babies together. And just because these children respond to this peer group pressure, what is it that's made medicine just sort of jump on board?
Yes. So, I feel like the social spread of gender dysphoria is almost a non-controversial topic. If you think of how fast it has spread, and that it came on just as there was just large uptick of youth into social media. So while their personalities are still developing, and you have these online worlds, and these online worlds have all these sub niches where people can kind of get lost in, and they probably do get camaraderie and support and other things, but they also can be transmission of a lot of bad ideas. And there are subcultures online which likely did contribute to the planting the seed that the problems are sort of related to gender issues, when a lot of these problems may have just been regular problems of adolescent development and growing up. And this may just be a regular sort of subculture, and there are experts who believe it is. It's like a goth or emo or another, typical adolescent phase that we shouldn't be medicalizing, and we should just appreciate it as that.
One thing we just spoke about was the fact that social media has had such a big influence, and maybe been more of an influence on girls than on boys. And I just wonder if you think that there's a different dynamic between the two genders who experience this problem. And And is there anything about that is sort of useful for parents to consider when they consider when their child shows up with suddenly tells them that they're interested in some sort of gendered transition?
Well, I do think that the genders are experiencing life differently, and I think, biological sex is an important mediator of personality development, and so I think it would be natural for each different, biological sex to experience this differently, and I think there are certainly one thing we note that girls, will co-ruminate more and are more socially influenced. Their emotions are more, socially contagious. And we've seen this before with online subcultures with girls more, like eating disorders or self-harm. So I think those things can be true for both. But I would say that the clinical sort of response is generally the same with, trying to refer to a good therapist and kind of figure out what's going on. And usually in either of these cases, there's comorbidities. So I think addressing those and looking at, just sort of doing bread and butter mental health care is the first step in either case.
When you've been confronted with a child that shows up with these thoughts, what's been your advice to parents? Because one of the issues that we're most concerned with is the fact that parents have contacted Do No Harm, our organization, and have sought some help, and we've tried to provide that. And I know there are a number of parents groups that do try to provide help, but what have you been able to tell parents that's been useful guidance for them?
Well, I think the first thing that parents need to know is that these are very unsettled and unknown approaches that they're being told they need to take concerning gender-affirming care. So I think, addressing the actual evidence base and being honest about the lack of, real solid evidence for transitions, even social transitions. I mean, this is these are things that need to yet be, really academically debated. I wouldn't rule out social transitions, but I would say you'd really need a very strong, justification for it, in a teen or in a young person. And, so it depends. Is this early onset gender dysphoria? Does it come on later? It kind of sounds like, more of the parents, certainly by the numbers, more of them are later. One thing that I would add too is that there's only recently have some of these really nice books have come out. So we have a lot of support now that we have the What to Do When Your Kid Says They're Trans book, which, is a fabulous look at, 3 therapists wrote it.
Dr. Kaliebe, you've been very outspoken about the literature and the scientific studies associated with this whole field. Can you speak to that issue? What do you think the status of the scientific studies of so-called gender-affirming care are these days?
Well, I think I've always been skeptical because I haven't seen the evidence, especially when we're talking about puberty blockers. The original studies from the Dutch have never been replicated. They have they have a small sample size. They were only using, early onset gender dysphoria, which is now really a very rarely used population. They took out children with comorbidities. They had strong parental support. And so that population that we have at least some longer term data doesn't look at all like most of the children that are being, medically transitioned to the United States. So I'm quite skeptical. I can say for sure we don't really have long-term data on the type of patients that are getting these gender transitions. And I would be very concerned that a lot of what we've seen that does seem to be positive is more like a placebo effect, or there are positives based on, social changes in the child's life that go along with making these transitions, but not positives that we do see may not even come from this treatment. The treatments may not be doing what people think they're doing. So nothing feel we're anywhere near the amount of evidence that we'd need to, roll this out as standard care. And we should just do regular psychotherapy and supportive therapy and treat comorbidities. That seems a much more logical and sensible approach.
Now, the the European community has come to a very different approach than is present in the United States right now. And while many of our audience may understand this case, could you sort of outline the differences between how the European nations, several of them, have decided to approach this issue of children with gender dysphoria compared to here in the United States?
Yeah, so what has happened overseas is that a number of countries have done reviews as they are, experiencing the same, burst of children who never seemingly have existed before that are now reporting gender dysphoria and presenting the clinics for treatment. And so the clinics that they did have in all of these countries were overwhelmed. That caused them, and the patient population looked very different from the population that they thought was going to be attending the clinics. And so that caused a re-look at what's going on. And I know in Finland, they asked for a review. They did a review. And these countries also have these organized medical systems, which, we definitely don't have in America. So they are used to reviewing evidence and looking at different disorders and problems and sort of deciding how, as a sort of country, they're going to treat it, where we don't really have that in the States. We have a whole hodgepodge system of how we do things. And so Finland, Sweden, and England have all done reviews and are in the process of, significant, along with some other countries, but those ones have done pretty substantial reviews and are all in the process of moving medicalized treatment for gender dysphoria to a much rarer or non-existent pathway, and then really trying to provide in the community supportive therapy. It seems like that would be the next step, but these are all still in flux somewhat, so we don't know where they're going to go, but they're definitely leaning away from medicalized treatment more towards psychotherapy and support.
So one of the things that keeps happening is that papers appear that suddenly are pointed to, identified as, now we have proof that this is beneficial. Inevitably, when you look at these papers, and people like Leor Sapir and others have written quite extensively about the literature on this, they point out the weaknesses of the study. What kind of study do you think really should be done at this point, or could be done, that would satisfy, and we have many medical professionals that are members of Do No Harm and probably listening to this as well, that you think, what kind of study do you think would sort of answer the question in a definitive way, whether we're harming or more children than we're hurting? We think that's the case by the experience that most careful people have identified, but what do you think a valid study would look like that might get at these issues?
Well, I think it'd be very hard to complete such a study in the States, but I think perhaps overseas we will see that, where they will only have, if you want to go this option, it will be part of a study. And I think people are going to want to ensure that this is a many-year study, because really you need follow-up. And unfortunately, we've begun all over the world these gender transitions, and even in these more organized systems, they have not continued to follow the youth into their adulthood and do not have sort of long-term data. And the long-term data is much more important than the short-term data. So I think it might be difficult to get that approved, and it would take a long time, but you would need to sort of start from early and follow them for many years. So it wouldn't be it would take a long time before we'd have that data.
So given that, and given how difficult this will be, what do you think the future holds for this whole field in the United States? If you were to look at the situation 4 or 5 years from now, how do you think it will play out?
I really don't know. That's an interesting question. I think that many states will decide that this is sort of not something they think is evidence-based practice and continue to restrict it. And I think there's some states who won't restrict it. That's probably how it will work out. I think that's a horrible outcome, because I would hope that the evidence base and what's best practice would actually rule the day.
So thank you so much for the insights that you've given us today. I just wonder if there's an aspect of your work that you don't think we've covered adequately that you'd like to make sure that our listeners know about.
Well, I think that the things that I'm trying to push forward as ideas, that the chain of trust in medicine has been broken, and that we've had terrible peer review, We've had advocacy placed over science, and that this has gone in the journals, it has gone on with the professional organizations, and this has led to harms being done. And we need major reforms to undo the groupthink and some of the clearly emotional appeals and the hard time that we've given professors and scientists. So my feeling is that that's the main problem, and if we can return back to just a rigorous scientific dialogue, that will solve a lot of these problems. But we do have a long way to go and lots of reforms to do to get there. But that would be my primary goal in speaking out, is to really restore credible, scientific and medical scholarly dialogue.
Well, that is so good. We need more people like you out there speaking up. How can people get in touch with you or see your writings or support you?
Well, I think the only writings that I've done for the public are on Substack. And so I'm actually I'm forgetting the name of where I published on Substack, but I have one article that I published, and I have a podcast. And this is really my second podcast, so only more recently I've decided to be sort of public-facing, because I feel like I've tried so hard to work through the professional organizations to get them to change, and they haven't really changed. And so, I have some articles in the professional literature, but it has been impossible to publish in the professional literature on this subject. So I've been locked out of that.
Now, I think what we have here is your Substack is called Restore Childhood. And,
that's right.
So restorechandhood.substack.com to get Dr. Kaliebe's insights and wisdom on this topic.
Well, thank you so much, Dr. Kaliebe, for coming on the program, and I'm sure we'll speak with you again.
Well, thank you both for having me.